Good afternoon. We'll now start. It's already 2 o'clock. I'd like to welcome everybody. But as a reminder, please mute yourself, but always show your video picture. Sign in your name, Facebook account, or email address in the chat box. Please include names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and at the end of the pep talk. Please show your face in the video during the picture taking. Another reminder is to take the online learning cum evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate. I have placed the link in the chat box as well as in the Facebook page. This is the sample of the certificate that one will receive after passing the OLETE. Another reminder, 50 OLETE certificates entitle one to a free voucher for ROJoson telemedical consultation. So this shows the sample of the voucher, which will be issued to those who will get have 50 OLETE certificates. So let's now have a group picture taking before we start in 2 minutes. Please turn on your video and show your face. Okay. 1, 1, 2, 1. Okay, show your face. Okay, 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9 last year, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. Last March 19, 2022, I took up abdominal disorders, and I decided to focus on these 5 common abdominal disorders: abdominal pain, abdominal mass, abdominal obstruction, abdominal bleeding, and jaundice. In that lecture, I just gave an overview. Okay. So we are done with abdominal pain, abdominal mass, abdominal obstruction. Now, today, we will go to abdominal bleeding. And then next week, we will be talking about jaundice. So my pep talk today is entitled Fundamentals and Generalities in the Medical Management of Abdominal Bleeding. I'll just give an overview. This is part of the health disorder course. The empowerment objective is for you to have an understanding of the fundamentals and generalities in the medical management of abdominal bleeding. Definition of terms in the title, and to delimit the coverage of my talk because I cannot cover everything. Fundamentals, the word fundamentals to mean simplest and essential facts and theories which can serve as a basis or foundation and support for advanced information. Generalities, general statements of information, not covering specifics and details. Medical management to mean diagnosis and treatment usually done by physicians. So the contents of this particular pep talk today will be what is abdominal bleeding, what are the different types, what are the causes, different causes, how common, how to go about doing a clinical diagnosis, paraclinical diagnostic procedures, and basic treatment modalities for abdominal bleeding. As I said, we will just focus on the fundamentals and generalities, the basic principles and the processes. What is abdominal bleeding? Abdominal bleeding is simply bleeding in the belly. As we said, abdomen, we define abdomen as the belly. And the belly consists of the following: the abdominal wall, and then the internal organs inside the abdominal cavity. So you have the solid organ like the liver, and then the hollow organs like the stomach, large intestine, small intestine. What are the different types of abdominal bleeding? So to answer this question, it is based on the source or origin or location of the bleeding. Since we talk about when we say abdominal bleeding, is bleeding from the belly, and we talk about the parts of the abdomen or the belly, okay, abdominal wall and then the internal organ. So based on this, when you have bleeding coming from the abdominal wall, yung sa labas, then we call it external bleeding. Nasa labas lang naman, okay? So when the bleeding is coming from inside the abdominal cavity, okay, we call that internal bleeding. Okay. So oftentimes we heard about the phrase internal bleeding. Okay. Internal bleeding just means you have bleeding inside the abdominal cavity, in which there are a lot of hollow and solid organs and blood vessels inside. A common cause of internal bleeding is the gastrointestinal bleeding, stomach and intestine. And then another example would be the uterine bleeding, and then urinary bleeding, blood in the urine. So what we call hematuria, it can either be gross, you can see it through the naked eye, or it's microscopic. It can only be detected in the microscope. Okay. And then another example of internal bleeding would be the ruptured aortic aneurysm. Okay. So there's another type which is not common, very rare, biliary bleeding. So bleeding in the biliary tree. So these are all examples of internal bleeding. And then the bleeding coming from the abdominal wall, we call it external bleeding. Okay? Internal, external. So what are the different causes of abdominal bleeding? So basically, two big categories: trauma and non-trauma. And then examples of traumatic causes of bleeding will be generally two types: blunt trauma, like vehicular accident, walang involvement of mga matutulis na instrument, like the gunshot wound or stab wound, in which we label it as penetrating trauma. Okay. So there are two types of trauma: blunt trauma and penetrating trauma. So whether blunt trauma or penetrating trauma, depending on the force and the severity of the trauma, you can have injuries that will cause bleeding. So when you have injuries to the abdominal wall, you can have bleeding from the blood vessels in the abdominal wall. Now, if it's internal solid organs, okay, you can also have bleeding from the liver, from the spleen. Okay, so these are examples of internal solid organ. You can also have internal hollow organ like the intestines. Okay. And then inside the abdominal cavity, there are a lot of big vessels there, like the aorta. Okay. Kaya kuminsan, yung mga pasyente na nasasaksak, tinatamaan ng big vessels, which result in instant death. Yeah. Now, for the non-traumatic causes, you have all of these as examples. Okay. Number one is the tumors, which can either be cancer presenting as a tumor or non-cancer as a tumor. And then the ulcers, varices, aneurysm, meaning abnormality in the blood vessels, and including some defect in the development. That's why we call it malformation. It can be also a source of the bleeding, inflammations and infections, and hormonal changes in the females. And then drugs. Drugs can also cause abdominal bleeding. These are some illustrations on the causes of the abdominal bleeding. So you can have a tumor on the stomach, okay, which can bleed. You can have tumors in the intestine, small intestine, large intestine, it can bleed. Okay, this one is the small intestine. Then you can also have a tumor on the large intestine, the colon, the sigmoid colon, which can also bleed. Okay. Erosions causing bleeding coming from the ulcer. Okay, so very common are the stomach ulcers, okay, which can cause bleeding, both massive and moderate and mild bleeding. Then you can have bleeding from inflammation and infection. Okay. The example would be colitis. No? And then varices can also cause bleeding. When you say varices, it's parang varicose veins, okay? And dilatation or enlargement of the big vessels because of defect in the on the wall of the blood vessel, or there's something obstructing it, causing dilatation of the blood vessels. Parang hemorrhoids din yan, varices. Okay? So you can see that a varices is bleeding here. Okay. And then aneurysm, especially of the abdominal aorta, because we're talking about the abdomen, you can have a rupture causing bleeding. Okay. So this is the aorta inside the abdomen, normal. And then because of the weakness of the wall of the blood vessel of the aorta, kakaroon siya ng dilatation, then magpapaloon out siya until if the pressure is so big, it will just burst, okay, causing bleeding. Then, of course, you can have hormonal changes in female, yung mga maraming inudugo through the vagina. Okay. So we've seen a lot of this. Okay. So hindi kasama yung pregnancy. So for the, now how common are the abdominal bleeding? Of course, non-trauma abdominal bleeding will be more common than trauma, especially in this age of a little peaceful na ngayon, okay? Unlike before, probably during the 10, 20, 30, 40 years ago, maraming patayan, okay? So you have a lot of traumatic abdominal bleeding. Okay. Now, among the non-traumatic abdominal bleeding, the most common is the gastrointestinal tract. Then others will be uterine bleeding, urinary bleeding are also quite common. Ruptured aortic aneurysm, not so common, but it's very serious problem. Biliary bleeding, very rare, very rare. Clinical diagnosis of abdominal bleeding. I will focus my discussion on the non-traumatic abdominal bleeding. And specifically, I'll be focusing on gastrointestinal bleeding. I will not be discussing about uterine bleeding and biliary bleeding, okay, and other types, aneurysm, etc. Okay, I will just focus on gastrointestinal bleeding for today. So, in patients with no history of trauma to the abdomen, the starting point in suspecting that there is internal gastrointestinal bleeding will be the following. If you have fresh blood in the vomitus, okay, when you vomit fresh blood, okay, that's already a sign of abdominal internal bleeding or gastrointestinal bleeding. The other cue will be fresh blood, talagang dugo on bowel movement or defecation. And then black stools, when you have black stools, hindi fresh ang blood, pero black stools, there's also a sign of bleeding. Okay. With some exceptions. Basta hindi ka lang kumakain ng dinuguan 1 or 2 days before. But if you have black stools, it might be a signal that there is internal bleeding going on. Okay. Then pallor or paleness, okay, but with abdominal symptoms, because pallor can be caused by a lot of things. These are the mga blood disorder, leukemia, okay, and nutritional, kung kulang yung mga pagkain, no, in terms of iron, then you can have paleness. So we have to qualify this pallor that if there is abdominal symptoms, then you suspect bleeding coming from the abdomen. Okay? Kung wala itong kaduktong na abdominal symptoms, it can be caused by other factors, okay, other diseases. So apat, fresh blood in the vomitus, fresh blood in defecation, black stools, and then pallor with abdominal symptoms. Some tips here, the basic tips will be the evaluation methods that will be used to do a clinical diagnosis will be history taking. When you do your history taking, you're actually getting the symptoms. Okay, you're trying to feel what you felt. Okay, if you're trying to treat somebody, you try to ask what were the feelings that patient or that person has. Okay, symptoms is the feeling of something by a particular person. Then the other basic evaluation method is doing physical examination. Okay, usually by the physician, but a empowered person can also do physical examination. But in the physical examination, the data that you gather are the so-called signs. Okay, in contrast to symptoms, this is from the history taking, what are felt and observed by a particular person. So after getting the data from the history and the physical examination, there's a need to process them to come out with a so-called clinical diagnosis. So this is the conclusion after processing this data. Now, for the symptoms, the basic data that you need in order for you to get into the clinical diagnosis will be, you first ask when the initial symptoms were noted. And then ask for how did it go? What were the subsequent courses? Okay. And then ask for any associated symptoms. Okay. So tatlong bagay yan. Okay. When it was noted, subsequent course, every day, as days pass by, humihina ba, lumalala, etc. And then what are the associated symptoms? Now for the sign or the physical examination, so the basic data will be, you look for a bulge on the abdomen, look for distension, baka masyadong malaki yung tiyan, unusually distended abdomen or big abdomen. Then after looking, you palpate, because sometimes the mass is small that you cannot see it through a bulge, so you have to palpate. So try to palpate for a mass and then also palpate for tenderness. Kung may masakit sa tiyan. So look and palpate. Okay. So then after you have done the basic processes of history taking and physical examination, you analyze further, okay, through repeated questioning, okay, until the diagnosis is quite certain that there is really gastrointestinal bleeding. Okay, so these are the clues, the general cues for gastrointestinal bleeding, kung meron ito, and then you have to go down to the more detailed diagnosis like the type, which we will discuss later, and then what is the specific cause. Okay. So always look for the specific cause after you have diagnosed a patient with gastrointestinal bleeding. So you have the disorder as the gastrointestinal bleeding, and then you have to go further and look for the specific cause. Okay, where it's coming from, example, where it's coming from whether it's being caused by a tumors or a ruptured aneurysm, etc. Okay. So when trying to look for the specific cause, we use the pattern recognition of a particular disease. So importante yung may alam konti na ano yung takbo ng isang sakit. Okay? And the prevalence process, because a lot of times yung mga sakit, they can present with similar symptoms and signs. So then if there are two diseases that present with the same symptoms and sign, to get to the most probable diagnosis, you use the prevalence process. You choose the more frequent one in the community. Okay? So that's what is meant by prevalent process. Then look for a mass. Okay. Always palpate the abdomen. Look for a mass as a possible cause. Okay. If there's a mass, most likely that's the cause. If there's no mass, then you use the color of the vomitus and the stools. Okay. And also the feces. No? Okay. Color of the vomitus and stools. Okay, whether it's fresh blood or black stools. Okay, so these are the cues. If you have vomiting of frank blood, yung talagang pula, and then black stools sa puwet, dumadaan sa puwet, in the feces, then you think of the so-called upper GI bleeding. Upper means say taas, no? Stomach and the duodenum. That's how we define it, no? Stomach and duodenum, usually stomach. Okay, when you say upper GI bleeding. Lower GI bleeding, if you have passage of frank blood in fresh blood per anus, then you think of lower GI bleeding. Okay. So I will now give you some case illustrations para mas malinaw. So starting point here in evaluation, if you have fresh blood in the vomitus, no history of trauma, tanggalin natin yung mga trauma. Okay. Okay. So once you have that fresh blood, you think of gastrointestinal bleeding. Okay. So usually, as I said, kung fresh blood in the vomitus, you think of upper gastrointestinal bleeding. When you say upper gastrointestinal, it's bleeding. It's coming from the upper part of the gastrointestinal tract. So usually the stomach, but the first, yung part of the small intestine, which is yung kaduktong lang doon, duodenum, no? Yung maliit lang. No? Okay. So that's upper GI bleeding. Okay. Then, if palpate, okay, if there is a palpable epigastric mass dito sa gitna, no? Okay. So starting point is vomiting of fresh blood, and then may nakapakang bukol, no? Most likely that's the cause of the bleeding. Okay. And then with the location and the fresh blood in the vomitus, most likely because ang pinaka-common na organ in that area will be your stomach. Okay, you start entertaining stomach because of the mass, bukol, then you think of stomach cancer as the possible cause. Okay. It could be due to other, yung mga pancreatic mass dito, liver mass dito, pwede din. No? But kung sa liver naman, usually walang suka na dugo. No? So in the stomach, the patient will be vomiting fresh blood kasi nasa tiyan. No? Okay. Pancreas, bihira as a first symptoms of vomiting of blood. No? Kasi medyo malayo yung pancreas dito pa sa baba. No? Okay. Now, if there is no palpable mass, okay, walang bukol, and there's no intake of drugs, you also have to ask, no, kung meron siyang iniinom na gamot, no, drugs that are notorious for causing gastrointestinal bleeding, then the diagnosis will be, as I said, if there is history of drug intake, no, okay, then the diagnosis will be drug-induced gastrointestinal bleeding. Okay? Walang bukol, pero taking in drugs that might be causing bleeding, then your diagnosis is a drug-induced gastrointestinal bleeding. Okay. If there is no palpable mass, another scenario, and also no history of intake of drugs that are notorious for causing GI bleeding, but there is a history of recurrent, palaging sumasakit ang sikmura doon sa taas, this area, for the past 3 months at least, then you suspect a peptic ulcer. Peptic ulcer naman yung iisipin. Na? Okay. Although other things are also possible, especially stomach tumor, which is very small, that it cannot be palpated yet. No? Okay. Okay. It can also be another diagnosis for the this particular scenario. No mass, no history of drug intake, pero may recurrent pain. Another illustration, this time fresh blood on defecation sa dumi. Okay. So start thinking of gastrointestinal tract bleeding. Okay. But now, because the blood is coming out through the puwet, through the anus, then you think of lower GI bleeding. Lower GI. Okay. So lower GI bleeding means bleeding in the lower part of the gastrointestinal tract, such as the anus, rectum, lower part of the large intestine. Again, palpate. Once you have this scenario, palpate. If there is a palpable left lower quadrant mass, most likely it is the cause. If there are associated difficulty in defecation, then a colonic cancer is the primary suspect. So that's how we go about doing the critical diagnosis. Now, if there is no palpable mass, wala namang bukol ka nakakapa, but there is anal pain, masakit ang puwet, no? At may bleeding, fresh blood, okay, this is fresh blood, on defecation, then a diagnosis of hemorrhoids should be the primary suspect, and then this should be supported by a digital rectal examination at the very least. Okay, so titingnan, kakapain, no? Kung may bukol, nakapa, then that's not, baka merong rectal cancer. Okay? Kung walang bukol, just dilated blood vessels, then you think of hemorrhoids. Hemorrhoids lang yan. If there is no palpable mass again, and there is no anal pain, kanina yung second scenario may anal pain, but this time, the third scenario is no, walang masakit sa puwet, but there is difficulty in defecation, nahirapan dumumi, and then a diagnosis of rectal tumor should be suspected. And then this should be investigated further. Kung fresh blood kasi, kung may tumor siya, medyo mababa yung tumor na yon doon sa rectum. So usually, a rectal exam should be done, kakapain lang kung may makapa. Kung may makapa, that's it. Okay? Rectal tumor causing the fresh blood. Okay. Third scenario, black stools, no history of trauma. Okay. Again, we have kung may black stool ka, think of gastrointestinal bleeding right away, but make sure that patient has not eaten recently. Okay, tinuguan, yung pusit na may itim na mga sauce, no? And then other foods that may produce black stools. Make sure these are not present. If these are not present, then suspect may bleeding na siya. Okay? And black stools usually upper gastrointestinal bleeding. Say taas. As I said, when I say taas, usually stomach. No? Okay, stomach and upper part of the small intestine. Again, palpate. So black stools, palpate the abdomen. If there is a palpable epigastric mass, may bukol dito, most likely it is the cause of the bleeding. And then with the location of the mass and the black stool, most likely you're dealing with a stomach tumor as the cause. But other causes are still possible kasi marami pang mga organs in this area like the large intestine, no? Okay. And then the pancreas, no? Liver, etc. Okay. But based on prevalence, yung pinaka-common, stomach cancer is the more common ones in this area. Yun ang first isususpect mo. If there is no palpable abdominal mass, and there is a history of intake of drugs that are notorious for causing GI bleeding, then the diagnosis is a drug-induced. Example of drugs that are notorious for causing gastrointestinal bleeding, na black stools will be yung mga yatawag na NSAID, like mefenamic acid, like ano pa ba yun? Dolphinal, no? And others, no? Okay. Yung mga non-steroidal anti-inflammatory agent, yung na NSAID. Then even aspirin can also cause bleeding. Okay. If there is no palpable abdominal mass and no history of intake of drugs that are notorious for causing gastrointestinal bleeding, but again, if there is history of recurrent abdominal pain, then you think of peptic ulcer, okay, as the possible cause. So the last one, case scenario, pallor or paleness, but with abdominal symptoms. So the way to go about it is you still think of gastrointestinal bleeding as the possible cause, but you have to examine further and to look for the specific cause. Again, you palpate the abdomen. Now, if there is an abdominal mass and then may pallor in pasyente, you use the location of the mass to aid to help you in the clinical diagnosis. Okay. So kung nasa itaas, then you think of the stomach. Then kung nasa baba, you think of the colon. Okay. Then evaluate the associated symptoms, particularly on the color of the stools. Okay. Okay. Pallor with color of the stools, then all of this data can help you come out with a clinical diagnosis. Okay, as to the specific cause and the type of the gastrointestinal bleeding. Okay, the next topic will be paraclinical diagnostic procedure for abdominal bleeding. Okay. The common instrumental and laboratory diagnostic procedures for abdominal bleeding are the following: imaging procedures, X-rays, either plain or with contrast, with dye, ultrasound, CT scan, MRI, PET scan, etc. And then endoscopy, okay, upper and lower. Upper is for the for the esophagus and the stomach. Lower, example, will be colonoscopy, sigmoidoscopy, and proctoscopy. And then blood tests can also be done, CBC, liver function tests, tumor markers, etc. So the principles behind the indications for the paraclinical diagnostic procedures will be the following. If you are not certain on the primary clinical diagnosis and you need to be certain or be more certain before you go to treatment, then you have to go for a paraclinical diagnostic procedure. Then to decide on the indication, the physician uses two processes, or you can use as an empowered person, you can also use these two processes. What is the degree of certainty on the primary, and then the comparison of the treatment plans for the primary and secondary. And as a rule, there is no need for a paraclinical diagnostic procedure if one, you are quite certain of your primary clinical diagnosis, and two, if the treatment plans for the primary and secondary diagnosis are the same. Pareho lang naman ang treatment, so you don't need to do the diagnostic test anymore. You just proceed to the treatment. The competencies required of physicians managing abdominal bleeding will be, as I said, there are a lot of instrumental and laboratory diagnostic tests that can be done. So the physician must know the uses and indications, and then use them only as needed and as indicated. And then how do we decide on this? So try to use the BRCA process, benefit risk cost availability process of the different options, and try to choose the most cost-effective one. Then after the diagnostic procedure has been done, the physician must know how to interpret the results. Okay. So the first result might not be the most accurate, there might be some errors. Okay, so the physician must know how to interpret. Okay, to be able to interpret the result properly, he has to connect it to the symptoms of the patient or the signs of the patient. Ibabangga lang, i-correlate lang niya yung mga clinical diagnosis. Kung di siya nagtutugma, there's something strong with the diagnostic procedure results. Okay, kung nagtutugma, then tanggap. Okay? Tanggap yung results of the paraclinical diagnostic procedure. So this is the illustration of the BRCA process in selecting the diagnostic procedure. B stands for benefit, R, risk, cost, availability. Okay. So basic treatment modalities for abdominal bleeding. So basically, tatlo lang: surgical, non-surgical, potentially surgical. When you say surgical, yung diseases that outrightly needs operation. Okay. And then non-surgical, those do not need operation, right? Okay. And then potentially surgical, ibig sabihin, pwede pang di-operahan, no? Obserbahan lang. And then if there's a need in the future, then surgery can come in. No? Surgery, surgical only when needed. Okay. So ililista lang naman yung mga diseases here, first column, and then classify them whether it is outright surgical, potentially surgical, or non-surgical. So examples of outright surgical treatment for abdominal bleeding, when you have massive, talagang masyadong maraming dugo, okay, and pwedeng gamutin through the operation. That's what's meant by surgically effective and remediable. Okay. And then kasi kung di siya remediable, so it's useless to do the operation. Okay. And then bleeding resectable tumors. Okay. Kasi nagbe-bleeding tumor, then outright surgical treatment. Unless yung tumor na yon ay hindi siya resectable na. Hindi na pwedeng tanggalin. Na? Okay. Ruptured aortic aneurysm. Okay. This is deadly if you cannot catch the patient on time. Okay. So dapat emergency operation to control the bleeding of the ruptured aortic aneurysm. The type of surgical treatment in general, okay, will be remove the cause of the bleeding either by resection of the intestine, okay, or by ligation, like this one, hemostatic suturing of the bleeders, no, itatahi, no, or occlusion and bypass of the ruptured aortic aneurysm. Okay. Now, examples of potentially surgical in which treatment in which watch and wait stance is better option and in which a medical management can be tried first will be varices kasi pwedeng pumutok, no? Pero at the current time, sabihin natin, at the current time, maliit pa, na baka pwede pang obserbahan, okay? Or gamutin muna, okay? Now, if it becomes they become bigger and then medyo risky na for bleeding, then if it's still operable, then you operate. Ganon din sa ulcers, no? Okay, so pwedeng subukan mo na sa gamot or watch and wait, and then if it's causing serious problem, then operation will have to come in. Okay, colitis, ganon din, no? So medical treatment first, and then kung may indication to do the operation. Small aortic aneurysm, pwede rin, bantayan muna, no? Okay. So, now examples of outright non-surgical treatment, yung talagang di kailangan operahan, will be the drug-induced GI bleeding. Okay, when you have drug-induced GI bleeding, the treatment here, tanggalin mo na lang, tigil mo lang yung gamot. Diba? Okay? Tigil mo lang gamot. You don't have to do operation on that. No? Okay? But rarely, very rare, meron din talagang kahit na anong massive GI bleeding na, no? Talagang dugong ayaw tumigil. Then, the surgeon will have to be forced to go in. No? Pero mahirap operahan yung mga ganon, drug-induced. No? And then, benign ulcers, ganun din. No? Okay. May mga benign ulcers na maliliit lang that can be treated by either medicine or just watchful waiting kung minsan nawawala rin by itself. No? Okay. Okay. Example, the illustration of the BRCA processes. As I said, maraming treatment options that we can be done. So try to compare the benefit of each option, then the risk, and then the cost availability. Okay. Then after presenting the data, okay, try to analyze and then try to choose based on the data given as objectively as possible, and then you can input your values, kung ano yung paniwala mo, no? And then your mindset, no? But try to control the biases, the hidden biases that you have within your mindset. No? So summary and takeaway for this pep talk will be, I discussed all these topics. I don't have to repeat them anymore. Then takeaway in relation to patient empowerment, be always in touch with reliable medical information on the fundamentals and generalities. Yun lang, pwede na. Fundamentals and generalities, because it's impossible to know everything. Okay, so just the basic processes and principles in the medical management of abdominal bleeding. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan. Remember, you have the right to decide on your own. Okay, after the doctor will give you all the data. Okay, nobody will force you to do this thing or that thing. Okay, so you try to decide what should be done for your own self, for your own good. Okay, so use these 4 Ks to gain greater control over decisions in the management of abdominal bleeding. Okay. So that ends my pep talk for today. I hope I have empowered you to have a better understanding of the fundamentals and generalities in the medical management of abdominal bleeding. Abdominal bleeding. Before we go to the question and answer portion, reminder, please take the OLETE. 50 OLETE certificates. We are now on the 45 or 44 pep talk. So there are now 45 OLETE certificates potentially available if you take all of them. Okay. So 5 na lang. Okay. So 150 certificates entitle you to 1 voucher for an ROJoson telemedical consultation. Okay. So with that, let's now have a picture taking before we start the QA portion. Picture, show your face, show your face, show your face. Last call. Last call. Okay. 1, wala na, natanggal pa isa. 1, 2, 3. Oh, lumitaw si Christy. Oh, Christy. 1, 2. Okay. Okay. We're now open for questions, comments, consults, anything. We still have 20 minutes. Any question? Anybody would like to share their experiences? Sinong sumasalita? Okay.
There is a question from Jocelyn P.
Okay.
I have an on and off stomach pain and maasim na stomach for years. CT scan of the whole abdomen, endoscopy and colonoscopy showed no bleeding parts. Results, hemangioma, colon diverticulitis, hiatal hernia, and GERD. Gaviscon and Proton Plus are not of great help. What to do next?
For years. How many years na?
Many years na, Doc.
Ha?
Nung nagfe-face-to-face pa tayo sa clinic nyo, I have this, maasim na stomach na. 2017, andyan na yung pain eh.
How painful is it? How painful?
May spasms. Sometimes, hindi naman masakit masyado. Sometimes, masakit na pumupulupot ako. Tapos yung mga balahibo ko tumatayo sa arms and legs. Ganun kasakit.
Okay. Kasi as I said, let me go back to the basic concept. No? When we diagnose a particular medical condition, we try to determine whether it is a disease, talagang disease that needs to be treated. No? Okay.
Mhm.
Or it's just something non-specific that is transient, that is, it's not the, I would call it medical condition rather than medical disease. No? Okay. So it's a medical condition. You can feel something, but it's not something that is serious. That's something that you have to be, what do you call that? That has to be treated. Kumisan, you don't have to, you just have to adjust the environment, no? And then adjust the environment and then look at it in a proper perspective, no? Kasi a lot of this thing, especially when you don't know what's causing it, natatakot ka na, may anxiety. Now, once you have anxiety, it will perpetuate yung nararamdaman mo, no? Okay? So you really have to clarify kung anong nangyayari. No? Yung sa iyo kasi, okay, kahit na for so many years, no, so it might fall into this medical condition aspect, non-specific. No? Kasi sinabi mo may CT scan ka na, no? Okay,
Yes.
may CT scan ka na, whole abdomen, endoscopy, wala namang abnormality.
Yes.
When you say bleeding, kasi yung pain na yan doesn't have to be caused by bleeding. Pero
Yes.
when you have CT scan, endoscopy, colonoscopy, titingnan mo kung merong mga ulcers, gano'n, di ba? That will
Yes.
cause the pain. Kung may tumors, that will cause the pain, no? Okay. Pero wala ka mo di ba? I assume wala.
Wala.
Aside from the no bleeding, walang tumor, walang ulcerations, di ba? Okay.
Yes.
So, ang nakalagay lang dito is, so, yung hemangioma was seen where?
Liver.
Ha?
Sa liver.
Okay, sa liver. So,
Right hepatic lobe.
okay, gadong kalaki yun. Maliit lang, di ba?
Small.
Okay.
Small.
So, when you have small hemangioma, okay, how to interpret that? No? One, it's kung small lang, it's part of, let's call it degenerative processes or aging process. Aging, tanggapin na lang natin, tumatanda naman tayo.
Yes.
So
Yes.
part of the aging process that I don't think if it's small, it will not cause any problem. No symptoms. No? Okay. So I don't think that's the cause of your stomach pain. No? The colon, when you say stomach pain, say taas, di ba?
Yes. Yes.
Okay. Yung colon,
Gitna. Sa gitna.
sa gitna. Yung colon diverticulitis mo, nasaan sa colon? Part of the sigmoid sa baba.
Sigmoid. Sigmoid.
Sa baba, no? Kung sa,
And no signs of inflammatory changes.
kaya nga. So, kasi you can have diverticulum without any complications, no? Walang symptoms, no? Okay. So, ang sakit ng nasa taas. So, it means yung colon mo, diverticulitis sa sigmoid, it's not causing the symptoms, no? Okay. So, you can just leave it alone kasi wala ka rin magagawa doon. That's part of aging, no? Okay. Colon diverticulitis. Ito yung sinasabi ko, potentially surgical, no? Sa ngayon, pwedeng wala kang gagawin. But in the future, if it cause problem, then that's the time you may have to operate. Di ba?
Yes,
Okay.
yes.
Example of indications for operation, magkakaroon siya ng infection kasi nagbaballoon out lang siya, di ba? Yung intestine, may outpouching, no? May mga weakness kaya lumolobo. So kung minsan pumapasok yung mga dumi doon, hindi makapasok ulit, hindi makabalik, no? So it can cause some infection, yung tinatawag na abscess, no? Baka hindi naman diverticulitis. Kung wala ka ng symptoms, diverticulosis, yung tawag doon.
Diverticles sinulat lang yan. Colon diverticles.
Diverticulosis.
Diverticles ang nakasulat, Doc.
Not litis, not itis.
Not.
Okay. Kasi itis is infection, no? Inflammation, no? So most likely andun lang siya, and it's not causing any inflammation, so dapat walang sakit 'yon. Okay. But in the future, sana hindi mangyari, it can cause some complications like an abscess, no? Okay, usually abscess muna. Pag abscess, masakit. Masakit kung saan may abscess sa baba, then you can have pain, no? And if it's ruptured, yon. Pag nag-rupture siya, mas malala na siya, no? Okay. But usually, if you are very health conscious, patient empowered, no? Hindi mo na papalalain until mag-rupture. Usually, kung may konting pain, papagamot mo na, no? Kung abscess pa lang, papagamot na lang, no? Hiatal hernia, unless hiatal hernia nasa
small.
Okay, yeah, it's small, and it's in the area of the esophagus and the stomach, no, yung junction. Okay. If it's small, usually you don't do anything about it also. No? It's not causing any problem. No? Okay, yung GERD, saan nakuha yung GERD? How was GERD diagnosed?
Wala lang. Sinabi lang ng gastro, ganun.
Okay. So, as I said, if I look at your question, no, and then sabi mo for years, most likely it's just non-specific, no? Kasi a lot of doctors, they don't use the word non-specific, no? They always look for a disease for you, no? Yan ang habit ng mga doctors natin, no? They will always look for a particular disease. Then sasabihin sa'yo, ito yung sakit mo, okay? Hindi niya sasabihin sa'yo, it's something na non-specific na obserbahan mo na lang. It's not something, you don't have to treat it. No? Okay. So, sa akin, it's more non-specific. No? Okay. Yung GERD naman GERD is sa akin, my personal opinion on GERD, which I will try to make a study also. I think it's a wastebasket diagnosis. No? Okay. So, it's pinalaki kung minsan yung mga medical world, pinapalaki yung isang bagay na hindi naman talagang disease. Pag na-brainwash na yung mga tao, no, malagi na iniisip, may GERD ako. Okay? So, but basically, GERD is just a reflux, no?
I have reflux.
Reflux, no? Okay. Kung gamutan naman sa reflux, is just, you just adjust your pagkain, no? Okay. So, it's not, yung reflux naman is not every hour, di ba? It's not every hour, it's every now and then, di ba? Okay. I also have reflux. I don't call it GERD. No? Okay. It's normal, and then it will just disappear. No? Okay. So think positively. You don't have any problem.
Thank you.
Okay. So you don't need all those Gaviscon, Proton Plus. That's why I said usually doctors will give you medicine. Mahirap i-explain kasi sa mga pasyente, non-specific, walang problema yan, walang problema. Mas madali magbigay ng isang sakit para sa iyo. Okay. And then they will prescribe medicine. Okay? Kasi they know that patients usually expect medicine. Okay? Kasi na-brainwash din tayo, di ba? Expect medicine. No? Okay? But a lot of times, all these medicines, kahit na hindi mo inumin, no? Okay, mawawala rin yung symptoms, no? Okay. Okay?
Thank you.
So don't take any positive thinking and then adjust your diet, adjust your yung mga ginagawa, no? Okay? Any more?
Thank you, Doc. Thank you.
Okay, welcome. Any more questions?
Nothing at the chat box.
Okay. So anybody would like to ask to consult?
Doc, ako po may share lang.
Okay.
Oo, regarding po sa brother-in-law ko kasi pag dumudumi siya may kasamang fresh blood. Then nagpa-check up po siya. Ang diagnosis ay internal hemorrhoid. Then niresetahan siya ng antibiotic pero after taking that antibiotic po, after completion, parang walang nangyari, ganun pa din. So, niresetahan siya uli ng another antibiotic na mas higher yung metronidazole. Pero nung tinake niya, wala pa rin po, parang mas lalong hindi maganda yung nararamdaman niya. So, tinigil niya yung antibiotic. Then, nagpa-second opinion, sinuggest po sa kanya na colonoscopy ba yun?
Colonoscopy.
Ayun, opo. So parang pinasok pa lang yung aparato, parang nandun na po kaagad yung yung mass, parang bungad lang siya. So mayroon pong colorectal o po bukol.
Wow, okay. Pero gaano katagal bago na-discover from these first symptoms? Years? Hindi naman.
Mga ganun, Doc. Mga siguro less than a year.
So buwan?
More than po, Doc. More than. Kasi parang hindi naman po kasi every time na nagdudumi siya may blood. Mayroon lang time na meron din minsan na wala. Pero nung time na talaga sigurong malaki na po yung mass, parang ang dami na blood pag nagdumi siya.
Okay. So how do I comment on that? Kumusta na siya yung brother mo?
So, ang nangyari po kasi, na-opera na po siya, Doc. Parang colorectal, tiyan, at saka yung tinanggal yung rectum.
Okay. Kailan siya na-opera?
2019.
19 pa.
Sa MMC po.
Okay. Okay, so how do I comment on that? Okay. In relation to our teaching. So, ilang taon na siya? Ilang taon na?
Parang, sir? Doc, 48, I think.
Okay, 48 years old. Ganun yan, ha? 48 years old. Male. Tama? Male.
Yes, Doc.
Okay. So, may fresh blood siya pag dumudumi siya. Okay? Fresh blood. Dumudumi. Tama? Yan ang starting point. Okay? So, on defecation. So, once you have fresh blood on defecation, you start thinking of gastrointestinal bleeding. Tama? Yung tinuro ko ngayon. Okay? And then, to zero in, it's most likely it's lower GI bleeding sa baba. Kasi fresh blood sa puwet. No? Kung fresh blood sa pagvomit, you think of upper gastrointestinal bleeding. No? Yung sa kanya sa baba. Okay? Now, nung kinapa, palagi ko walang nakapangbukol. Okay? Sa tiyan. Okay? So, kasi mababa. No? Okay. And then, as I said, kung walang nakakapangbukol, okay, may pain ba siya? Tatanong mo, may pain ba siya pag dumudumi siya?
Meron, Doc.
May pain.
May pain.
Okay. And then, okay, yan ang turo ko sa inyo, di ba? You get the details. So, may pain siya pag dumi. Okay, ang pinaka pwedeng hemorrhoids, pwedeng tumor. No? Okay? Pero mas common yung hemorrhoids. No? Okay? So you, as a doctor, you first think of hemorrhoids. No? Okay? When you say first thing, yan lang iisipin mo, pero i-investigate mo pa further, no? Titingnan mo, no? So hemorrhoids or tumor, no? So the other data that you have to gather is pagka-dumi ba niya right after defecation, may dugo. Natatandaan mo ba yung istorya?
Parang hindi ko po na ano kung before or after ng magdumi siya. Basta po pag nagdudumi siya, parang pinakita niya kasi yung fresh blood eh.
Okay. Okay. Kasi yung hemorrhoids, usually, ang takbo ng hemorrhoids, gano'n, right after defecation, tumutulo. Okay? Yung sa ano, sa ano, bowl, no? Sa toilet bowl. Then, when you wipe it, no, may dugo. Okay? Yung wipe ng puwit mo. No? But usually may sakit. May masakit ng mahapdi. No? Yan ang hemorrhoid. Okay? So, kung tumor, usually walang sakit yan. At usually hindi siya, kahit na hindi siya dumudumi, pwedeng may lumalabas. Kasi ando yung bukol eh. Di ba? So, pwedeng mag-drip down yung blood pababa kung dumudugo. No? Okay? So, that's the difference between hemorrhoids and the tumor in terms of bleeding. No? Okay? Ngayon, sige, ang pinaka-importante doon, nasundot ba yung puwit niya? Kinapa ba yung puwit niya ng doktor? Yan ang tanong.
Yun lang po, hindi ako sure kung kinapa.
Okay. Kung ako, ang gagawin ko, susundutin ko yung puwet. Di ba? Rectal exam. No? Ngayon, kung nagte-telemedical consult tayo, no, hindi ko masusundot, okay, I will, based on kung anong symptoms niya, titingnan ko ano yung number 1, number 2. Okay? So, kung hemorrhoids number 1, number 2 yung cancer, no? So the next thing that I am going to do is to observe, no? Okay, usually 1 week, 2 weeks, no? Okay, and then ang gamutan kasi ng hemorrhoids is not antibiotics, no? Okay, okay, that's another pitfall, no? Hemorrhoids, you don't give antibiotics. Ang hemorrhoids, ang problema ng hemorrhoids yung bleeding, di ba? Saka yung sakit, di ba? Okay. Okay. Yung sakit kasi dahil doon nagagasgas, may wound siya, no? Hindi antibiotics, no? You don't need antibiotics dun sa puwet. Madumi naman talaga yung puwet from the very start. Kahit anong gawin mo antibiotics, no? Hindi mo malilinis 'yon, no? Hindi mo malilinis with antibiotics, no? You just have to clean it, no? Okay. Anyway, nabigyan siya, sabihin natin, for whatever reason, nabigyan siya ng antibiotics. No? Okay. So, hindi siya gumaling. After 2 weeks, dapat, I will, kung ako, susundutin ka na. No? Investigate further. No? Okay. So, kakapain ng puwet. No? Kung kinapa yung puwet, as you said, yung final event is meron talagang bukol. Di ba? Okay. So kung kinapa ng doktor, instead of changing the antibiotics to metronidazole and others, mas mahal, no? Okay. So kung kinapa niya, ayun na, madidiscover is the tumor. No? It doesn't have to take 6 months na bago ma-diagnose. No? Okay. So sa isang daliri lang, kapalang, makikita na eh. No? It doesn't need colonoscopy. Colonoscopy, pwedeng wala rin eh. Di ba? So, kasi yung colonoscopy, maganda lang yun kung nasa itaas, kasi mas mataas. No? Hindi lang sa rectum, sa colon, sa sigmoid colon, sa upper part. No? Okay? Okay? So, kung nasa puwet, wala. So, na-discover yung cancer sa puwet, so nag-undergo na siya ng, tinanggal yung puwet, may colostomy na siya ngayon, di ba? May colostomy. Okay.
Yes, no.
Okay. So that's how you process, no? Okay. So how to diagnose a lower GI bleed? Actually, 3 months ago, meron ako exactly the same Ganun din. Ganun din. Diagnosis ko, sabi ko, kasi telemedical, hindi ko masusundutin puwet niya. So, sabi ko, i-observe lang natin, no? Pero palagi ko, after 2 weeks, pag di pa wala, magpaano ka na, colonoscopy. No? Okay. So, nagpa-colonoscopy siya, true enough, may cancer. No? Okay. Pero yung sa kanya, mas mataas. No? Okay. Mas mataas ng konti. No? Okay. Okay. Any more questions? Any comment, Mel?
Thank you, Doc. So parang ang takeaway ko doon, Doc, parang kailangan pala mayroong first, second, third opinion talaga. Kasi po yung sa first, talagang sabi ng doktor, no need daw for the colonoscopy kasi mahal yun. Hindi, sabi niya internal hemorrhoid lang yan, sabi ganon. So since kasi parang continuous yung parang yung bleeding parang nag-worsen, kaya nag-seek uli sila ng another advice. So yun na yung
Yeah, okay.
Parang nung nag-colonoscopy ba ang term doon, hindi na po sila pinalabas ng hospital, diniretso na po operation.
Okay. Okay. So, ang sinabi mo, ang takeaway is, takeaway will be look for second opinion. Now, when you say look for second opinion, pwede rin, but make sure ano ba yung tinuro ko sa inyo yung sa first part of the course? You can have second opinion, third opinion, but make sure that the second person is doing a better job. Kasi pag pumunta ka sa isang second doctor, ganun din, baka mas malala pa, hindi siya magaling, hindi mas magulo, di ba? Okay. So, as I said, yung doctor is somebody who will give you a diagnosis. Sa kanya binigay siya ng hemorrhoids, no? Pero dapat tanungin mo anong basis niya for saying it's hemorrhoids, no? Okay? So assuming na kasi wala naman kayong alam diyan, sinabi niya, okay, ito yung basihan ko, hemorrhoids, no? Okay. Then take into consideration that all doctors are not 100% perfect all the time, di ba? Kaya sabi ko may secondary diagnosis, no? Okay. So after the first, sabihin natin, tinit niya ng hemorrhoids at hindi siya gumaling, dapat may follow-up right away. May follow-up. So sabihin sa'yo, 1 week na ayaw pag gumaling, bumalik ka sa akin, titingnan pa natin. No? Okay. Ngayon, kung yung mga doctor sabihin, hemorrhoids lang yan, umaliwala yan. No? So walang follow-up. No? So, kung nagkamali, lalalaing condition. No? Okay. So, dapat yung doctor will also have a follow-through. No? Okay. Then, when you look for another doctor, yun nga, maghahanap ka pa rin yung whom you think will be, pero mahirap, no? Mahirap sabihin kung paano ka maghahanap unless kilala mo. No? So it's better to have it's better to have a trusted doctor in the family. Na? Okay. Whom you can consult kahit na no doctor can say he knows everything naman, di ba? Parang ako, hanggang surgery lang naman ako, surgeon, no? Okay. But may mga doctor na who can give you advice, na good advice, na? So, kung kanino kayo pupunta, ganon, na? Ganon. Okay?
Okay, Doc. Thank you, Doc.
Okay.
Okay, Ma'am Jocelyn, would you like to say something about Mel's situation? Or would you like me to read your
You can
text
read
here?
it, Beth.
Okay.
Okay.
This is from Ma'am Jocelyn P. In relation to Mel's case, I have a friend who had colonoscopy for her blood in stool. Result was internal hemorrhoid. She has taken antibiotics, but even after that course, there is still blood in her stool. What is the best for her to do now?
Okay, consult ito. Okay, how old is she?
40 plus or 50, early 50.
Male, female? Her.
Female.
Okay, when you say blood in the stools, anong ibig sabihin nun? Fresh blood?
Fresh blood.
Fresh blood lumalabas.
Yes.
Okay. So, nagka-colonoscopy siya.
Yes.
Okay, internal hemorrhoids lang.
Yes.
Okay. Okay. May antibiotics. As I said, antibiotics will not is not really helpful. But up to now, may blood pa rin siya.
From what I remember, yes, meron pa.
So it's baka recurrent bleed kasi total may colonoscopy na siya. Kailan yung colonoscopy niya?
This year lang,
Okay.
months ago.
Okay. So we assume correct yung colonoscopy, but always have in mind possible error then, ha? Okay, always have that in mind, especially kung persistent in bleeding niya, na? Yung bleeding.
Oh.
Now, as to the type of bleeding, anong klaseng bleeding? Malakas ang bleeding o pag dumudumi lang siya?
Pag dumi-dumi lang.
Okay. So baka talagang may malaking hemorrhoid siya na pag dumudumi siya, talagang dudugo. No? Okay. So the best way is na kung talagang yung bleeding is coming from the hemorrhoids, no? Persistently, no? At malakas, then she should have her hemorrhoids removed.
Oh, okay.
Okay? Ganun lang.
Okay.
No? Okay? Assuming
Okay.
tama yung colonoscopy niya. Okay. Pero usually, basta hindi lahat ng hemorrhoids na may bleeding kailangan operahan. Ha? Okay. Kasi yung mga ibang doktor, gagamitin nila yung rason yan. No?
Yeah, yeah,
So,
yes.
may hemorrhoids ka, nag-bleed na, operahan na kita. Okay?
Okay, thank you.
Ako rin, nagkaroon ng hemorrhoids. Up to now, hindi ko pinapa-opera. Okay? 20 years na.
Yes.
Okay? Paminsan-minsan, babalik yan. Especially kung constipated ka. Okay? So, but
Okay,
if
thank
the
you.
bleeding is persistent, yung paulit, yung let's say, malakas, saka hindi siya tumitigil, no? That's time you have it removed. No? Okay.
Okay, thank you, thank you.
Okay.
There is another one from Maria Justa Pulotan. Dr. Joson, what exactly is an anal fistula? What causes it, and is it common? Thank you.
Fistula, ito yung puwet natin, na? Okay. Ito yung rectum padaan. Now, there are glands dito may mga glands din tayo yung nagsisecrete na mga mucus sa intestine natin, na? So, if one of these glands becomes infected, na, kakaroon siya ng abscess, di ba? Okay. Pag nagkaroon siya ng abscess, kung di siya nawala, lumalaki, yung mga pigsa naman, usually maghahanap siya ng weak point at ilalabas niya, mag-ruptured siya, di ba? So, kumisan, lalabas dito yan sa may balat, no? Kung itong puwet, no? So, kung ito yon, baka lumabas siya rito, may butas dyan, di ba? Ganon. So, pero yung connection nito sa loob, no? Okay, ito yung balat, ha? Balat ito sa labas, no? So, ito yung opening, no? Okay. Ito yung opening doon, no? So, fistula is basically a communication between these two, no? Dito. Kaya, in the end, parang may tunnel siya. So, pag dumudumi tayo, ganito, yung iba naman, may pumapasok dyan, dito lalabas. No? Yun dito. No? Okay. So, may dumalabas na nana, dumi rito. No? Yan lang nakikita sa labas. No? Pero if you look at inside, may communication sa loob. No? So, yan ang fistula. No? Maraming klaseng fistula, depende sa yung iba kung saan sumisiksik, no? Pag ganon. Iba-iba, no? Yung iba naman may mga communication, no? So depende sa severity, no? Okay. So how common is it? Quite common. Quite common. We don't know the real cause, no, exact cause, pero it's quite common. No? Okay. And then the cause we don't know. The only thing that we know is nag-infect yung gland. But bakit nag-infect, we don't exactly know. No? Okay. Is it because pwede mo sabihin, ay kasi hindi siya dumudumi palagi. Pero marami rin tayong mga tao na dumudumi everyday, di ba? Walang problema. So we don't know the exact cause, no? And is it common? Yeah, quite common. Okay. And just hope that hindi tayo tamaan, no? So, in my family, yung brother ko tinamaan. But that was 30 years ago. No? Did I answer your question, Gusta?
Yes, doctor, yes.
Okay. So any more questions?
None at the chat box at the
Okay.
moment.
So it's 3:19. Last call. Sige, meron pa bang pahabol? Okay. So if there are no more questions, let's call it a day because it's already 3:19. Okay. So we will have the next session next Saturday. Ano yung susunod? Jaundice na, no? Jaundice, no? Then after that, probably right upper quadrant. Gallbladder tayo. Gallbladder tayo. Okay. So,
Thank you, Doc.
so no more questions. Let's call it a day.
Thank you, Doc.
Sige.
Bye, everyone.
Bye-bye.
Thank
Bye.
Bye.
Bye-bye.
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 Bye-bye.